Okay, good afternoon and welcome everyone. I'd like to call to order the Macon County Health Department Board of Health meeting for March 15th, 2022. Roll call, please.
Vivian Goodman,
Here.
Mark Scranton,
Here.
Jan Hack, Sue Krause, Candy Clevenger, Jeff Entler,
Here.
Debbie Hill, Dr. Brett Jerger,
Here.
Dr. Ben Kevin Gonti,
Yes.
Cody Parks,
Here.
Dr. Janet Patterson.
Here. Are there any changes to the agenda?
Jeff would like something.
I asked to put something on, I'd like to talk about the possibility of having a monthly report from each one of Brandy's directors to maybe a 10 or a 15-minute talk to tell us what they do, some of their challenges about their staff, not just for the new people on the board, just a good refresher for everybody, and maybe to just have some focus and highlight it, the department, and tell them they do a good job.
Okay, so we're going to talk about monthly reports from staff. Yes.
No, nothing that I.
Is that right? And I have a motion to approve the agenda topics as amended.
So moved.
Second.
Thank you. Roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Dr. Brett Jerger,
Yes.
Dr. Ben Kevin Gonti,
Yeah.
Cody Parks,
Yes.
Dr. Janet Patterson.
Yes.
Motion carried. Thank you. Approval of previous meeting minutes from February 15th. Oh, I'm sorry. Do we have any public comment? We didn't. Okay. So I'll entertain a motion to approve the minutes from February 15th, 2022.
Second.
Are you making the motion?
Yes.
Okay,
Second.
thank you. Any questions? Any changes to the minutes before we vote? Okay, roll call vote.
Vivian Goodman,
Approved.
Mark Scranton,
Approved.
Jeff Entler,
Approved.
Dr. Brett Jerger,
Yes.
Dr. Ben Kevin Gonti,
Yes.
Cody Parks,
Yes.
Dr. Janet Patterson.
Yes.
Motion carried. Communication.
Okay, have a few things that you have asked for that I will update in this section. The first thing I wanted to just make you aware of is I know last month I mentioned that we were still short, actually 2 roles in administration, the admin assistance roles, and then an IT support staff. And so we have filled all those positions and very happy to report we were able to fill them with the staff that we had hired in the contact tracing grant. So really excited that they have joined the team as permanent members. And Susan is here. She will be taking over as the primary lead for doing all of the board function with us. Lakia has been wonderful to help cover for that. And so we're happy to have Susan. And then Michaela also joined administration, so she may be here covering if Susan ever can't make it. And then if you were here a little bit ago, Luke has joined with IT, so you may see him here in the room. So of course we've hired for a lot of other positions, but those are ones that you will deal with maybe more frequently or see them here at the meetings more often. So I just wanted to make you aware of that and welcome them and let you know they are in training with us. And then another update, keyless entry. We were able to get all of the data entry that we talked about last month. All that has been done. In addition to that, we were able to get about 60% of staff already credentialed, and they're in the process of doing that right now. And they are able to already use the doors with the keyless swipe. So that's exciting, and thank you to the team that has been able to make that happen. And then getting into COVID updates. Some of this I sent in email, but I did want to just review it while we're all together so that you have the opportunity to ask questions or talk through it together. You'd asked me just to give updates about numbers and any transitions that we were going to be making. We have moved, as I mentioned, some of the full-time contact tracers into permanent positions. 3 recently that I just mentioned, and then we had moved another one into a permanent position sometime last year. She's still here with us, so really excited to be able to do that. As of the transition on March 5th, which is what I emailed you about, we did cut down the number of full-time contact tracing staff. We maintained the 3 team leads The things that they are able to do and the systems they are able to access, they were going to be the ones that could complete all of the functions, including the interviews and the more basic contact tracing. And then one contact tracer that is assisting with wrap-up duties and any kind of response or calls that are coming in, complicated situations, outbreaks. So we have 4 that are still full-time right now. And then we did transition the people who were full-time, other than these 4, they did go to part-time. And then we moved the part-time people to more of a PRN or an as-needed role. The reason we did not just completely terminate them from employment was because if they were willing to stay on with us, then we already have them onboarded, they're ready to go just in case there's some kind of surge again, that we can just kind of call them back up. We did have them go ahead and start turning in their equipment so that we had that and kind of didn't lose track of them if anybody became disconnected. And if they need to have that assigned back out, if there's a surge, that can very quickly be done by our team. So that was done, the turnaround on that was fairly quick. We were able to give them more notice than the last time we made a significant change. And so that's gone pretty well. And all of the care resource duties and all the contact tracing, outbreak management is being handled by the part-time and full-time staff that are still intact. So right now we have, as I mentioned before, and then we have 22 that are part-time. That includes the ones that are working actively and then the ones that are the PRN status. Then we are planning for some additional changes effective March 21st. We would like to change the frequency of reporting. We're looking at making it once a week. We've tossed around once a week or twice a week, and so if you have any strong opinions here tonight, we can definitely talk through those if you have a preference of once or twice. And then we are changing the operation to Monday through Friday. The amount of calls that are coming in on the weekends is close to 0. And so we don't want to continue to have staff working because then you have to have supervisory at least on call, and the trickle effect of then who all has to be responding. And we're just not having the need on the weekend. So we feel like after all this time, it's time to adjust to the Monday through Friday. This would include our vaccination operator line, which is barely being used now by the public. Those calls are being answered by our main line. Those people are still being seen to get vaccinated, so that will all still be happening. They'll just have our main number. We do already have communications in the works to be able to inform the community of all of these changes. And there will be a recording on the vaccination and the COVID operator hotline, so when people call, it won't just ring, ring, ring with no answer, and it won't just disconnect them. So they'll at least be able to hear a recording. We also would like to adjust to not staffing all of the holidays. Historically, we've done them all up until this past Thanksgiving and Christmas Day and Christmas Eve. So we would like to adjust to no holidays. Again, that takes away the need for staff time, supervisory time, and all of that, and we're just not seeing the need at this time. And we still will have our answering service intact, which is something that if there are area providers that have some kind of emergency or there's a communicable disease that needs reported, that number is always accessible and even was before COVID, so that if there is an emergency in the community that a provider has, that they are still able to reach us. So that is what I have as far as logistics and contact tracing and staffing and all the changes that we have made and would like to make moving forward.
Brandy, the 22 part-time people, how many hours a day?
So when we first changed to on March 5th, they were scheduling them for 20 hours, and then they would do what we had talked about, where they'll clock in, they'll check and see if they're actually needed, if there's anything assigned to them, and if there is not, they would clock right back out. Or if they were working phones, based on the volume that was coming in, we would basically have people clock out that were not needed. And now they are decreasing that more, and they plan to again decrease it more on that March 21st date, because we keep a shift schedule in Teams, so our staff can constantly watch what their schedule is that is coming up. So they're being communicated with by our team leads and letting them know your hours are going to be decreased. What might have been on the schedule has now changed. Please check your schedule. So those hours are going down. I don't know with the March 21st adjustment if they're going to go down to like 10 or 5, but they don't get that number of hours guaranteed. It's always you clock in. Is there any work assigned? If not, you clock right back out.
I don't understand why we keep 22 people on a part-time job that they may or may not work, especially at $5 a gallon gas. I mean,
They don't come here.
okay, so
They're not
they're not
working.
coming here at all?
No, so the part-time people are the ones that are working, but they are all remote. Like our team leads come to the building, but that's because some of their functions, they have to work in the building. But then there are some days that they are remote, but they are also moving to the Monday through Friday schedule. So that will somewhat affect that, but a lot of their work is remote as well. All of those contact tracers are working remotely. So even when they do clock in and if they have to clock right back out, they're just doing that at home. And then the PRN staff, they're not clocking in at all right now, and their email access has been terminated. So there's no work being performed by those PRN people. They will be called via phone call to their personal number if they are needed at some point, if there is a surge. And we're not going to keep them on forever.
What does PRN stand for?
It's like as needed if somebody, sorry.
Just as needed.
Well, why don't we give the people the benefit, instead of 22 part-time people, why don't we cut the number of people and increase the other people's hours? I mean, you're still gonna spend the same amount of money, but logically, I think that would make a lot more sense.
Well, so a few reasons. All of those 22 people are not working or even active right now. I think that the number, without glancing, that we have active is probably around 7 or 8 active part-time that are even clocking in at all. And we cannot, with the workload right now, we cannot have even part of 7 or 8 in addition to the 4 that we did keep. We can't have them actually working for 7 hours a day. We don't need them that much. So it didn't make sense to keep them full-time other than these 4. And of course, we won't keep those 4 forever because as the need continues to decrease and they're able to wrap up all of the cases and clean everything up as far as with data entry with IDPH and all of that, then those people won't be in those positions forever either. So the bulk of the staff that are PR and part-time, they're not clocking in, they're not working. It's not like we equally distributed all the hours to all 22 of those people. We only are giving the hours to the people who were full-time. There's, I believe, 2 part-time people that were part-time who did not go PRN, and that is because of the assignments that they had. They're still part-time, but they had very specialized training, so they're still working part-time.
So the rest of them are just in case.
They're just, yeah, they're basically, you would almost call it like an on-call list,
Yeah.
where they're not regular working, they're not expected to check their email, they're not coming to training. It's literally just like an emergency on-call
They're not
list.
getting paid, they're just willing to.
Yeah, they're not getting paid anything, no, not at all. And then the part-time people, you know, the ones that are just working part-time, they're not being paid benefits. It would just be those 4 that have been maintained at this point, full-time.
Any other questions for Wendy?
Are we gonna, do you want to talk about that now, about how often to do it, or did you want to wait till later?
Whichever, I just thought I'd go ahead and throw it in this part, but I mean, if you all want to talk about it now, I'm okay with that. We had thought about going ahead and changing it last week since you all had given me discretion, but I figured since we were meeting in a week anyways, I might as well just wait so we could talk through it.
I think you should decide, because it comes from the board again. I don't want to be getting 6 phone calls from people complaining about it.
Well, we gave her, we
Yeah, I'm
already.
okay with that.
It needs to be clearly identified that you made that decision, and it's a directive coming from you, because I guarantee you, nobody's gonna pay attention to that. They're gonna say the board's gone back to changing this again, and then we're gonna catch a lot of grief for it.
Well, we actually
Well-
talked about, this is the most we talked about reassessing it anyway.
Exactly.
I mean, we had already talked about the meeting, you were not here on
Yeah.
that. Jeff had mentioned that we would reassess it in March, and, which is perfect timing, actually, by the way, on that one, so.
I
To me, it
think
makes
the
sense,
numbers
like you
justify
said,
it.
add on weekly, I don't
Change
see
it.
there's any reason to spend the time on that one.
Right.
My only question is also, the other thing I would request, I don't know how you guys feel, I think the number of deaths since the start of the thing needs to be taken off. I don't think that needs to be on there anymore.
Yeah.
I don't see what purpose that's
It
feeling.
doesn't serve any purpose.
So unless you guys disagree with me on that one, I would recommend that we take that off.
Well, some people like it, like.
Well, but the downside is that, like we talked about before, you don't know what, like Dr. expressed before, which deaths are from COVID and which ones are, they died and they had COVID at the same time. So in other words, we're not even giving out true information at that point. We don't know that. And they've talked about that, the fact that, most of the patients who died have had at least 4 to 6 other issues in their body, and it wasn't actually COVID that caused them to die. So it's kind of misleading even to let people know that. Now, if we had the breakdown of exactly what it was, I'm all for it, 100%. But over 60% of the people who passed, and even CDC's put that out, is not because of COVID. They died with COVID, but they didn't die because of COVID.
No, I'd like to differ with that because at least I can speak for DMH. I can't speak for the other hospital. I don't work there. Most of the are done with good intentions to see what exactly is the cause of the death. Yes, there are people who come for other reasons and they happen to be incidentally positive for COVID. Yes, they may have died from cardiac problems or other problems. But most of the numbers, I can't speak for the entire county because I can only speak for DMH. That's where I work. Yeah, they're fairly accurate. I mean, yes, could there be some other patients that have had COVID but died from other non-COVID related conditions? Yes, it's possible. So I'm not saying I have dwelt into all the records of the deaths in the hospital. No, I did not. But I can say a fair amount of that is accurate as far as DMH is concerned. I'm not speaking for the hospital, but as a professional, because I look into those cases myself, some of them. I know which one died from COVID and which one died with COVID.
But you're talking about cumulative deaths that we keep posting.
Right.
So if you put deaths on there for that week along with your other
Oh,
statistics.
no, that's not what
I
I'm
don't
talking about,
think
the
that's an
cumulative
issue.
one,
Yeah.
number since the start of the pandemic.
Yeah.
Because we got rid of that, the same thing. I thought we were getting rid of both the number of cases since the start of the pandemic and the number of deaths since the start of the pandemic, but that number has still been on there. I totally agree with it as we go along weekly to let people know that, because people want to know that. Cumulative numbers is what I'm talking about.
Yeah.
To me, that's just a scare tactic. I don't know why that we have that on there.
Anyone else?
I tend to agree with that. I'd like that cumulative number off. What do you think, Brandy? You're again going to be the one that's going to bear the question.
I mean, I definitely see, what you're saying, and our purpose has never been to instill fear in people, but I also, we have people also that have lost their loved ones, whether it was, when they had COVID or they died from COVID. We've always been very careful to say people have died with COVID and not said died from COVID, because we were aware of this, even before we did our very first report. And so I would really like the board, if you all want that removed, to decide on that, just because I do feel like the community probably wants to know that, the people that, care a lot about it, and especially those who have lost someone. And so that's probably not something I would remove if I was making the decision myself. I mean, we're gonna quit reporting at some point, probably in the nearest future anyway, if we don't go into another surge or something. So I feel like the statement or the perception of doing that right now when we're so close to just wrapping it up anyway could be very poor, especially coming from a public health department.
I think people want to know what's happened the current week. Past history doesn't, because from one week to the next, you can go back and look and say, okay, it's gone up, it's gone down, it's gone up, it's gone down. I can't even tell you what I did 2 weeks ago, let alone remember 18 months ago. History, if somebody wants to look it up that bad, they can do the research, or, it's out there, the information's out there if people want to look that up. State, CDC, everybody's pretty much turned the switch off on this stuff for the most part. You don't even see it being reported on the news hardly at all now. So I think you should do current statistics, and I'm good with once a week reporting. So I don't know if we need to make a motion for that or not, but.
We just need to agree, because we already gave Brandy the go-ahead to change it whenever she felt that it was time.
Well, that's what I'm saying, she
So-
brought it up now to change it, so do we need to make a motion to approve that change? She's asking for some guidance, whether we want to do once a week or twice a week, so, we got to tell her something.
I think our guidance for her, since she's already the one, is consensus on it. I don't think there needs to be a motion for that.
Okay.
Once a week, that would be
I'd go with once a week.
Preference. And you're down to twice a week now, aren't you?
No, we're Monday through Friday.
Still
We
doing
were
the
looking
day.
at putting it down,
I
but that's what I
I
decided
thought
to
I
just
looked
wait.
and I thought it was, okay.
They don't talk about it on the news anymore hardly at all.
No.
I mean, the local news, and if you watch, they don't really talk about that much on.
Hey, Brandy.
Okay, so,
Yes?
We are reporting Monday and Thursday.
That's why, I thought we were 2 times.
Oh, I'm
a week.
sorry, I thought you hadn't implemented that yet, I apologize.
Yeah, for probably about 2 weeks, right?
At least.
Yes, roughly 2 weeks, yeah.
I'm good with once a week. I mean, the numbers are down enough. They're way down from what previous, so yeah, I'm fine with once.
Nobody's complaining about going to 2 days a week.
Oh,
So-
no, I haven't heard a complaint at all.
So- Let's go till we get a complaint.
Okay, so we can do that, and that probably won't even be that noticeable anyway, but, what about, I guess, a consensus on the cumulative deaths?
I don't see a point in it.
I don't think we should change
I think
it.
the current ones for that week, absolutely, to let people know, but not the cumulative.
When's it gonna stop completely? I mean, I know that's a loaded question. What I'm saying is, how many more weeks you think it would go if we just leave it like it is? And that way we don't stir a bunch of feathers.
I'd ask that man there, he knows more about it than the rest.
I don't mean how much
of us.
longer is this one, I'm saying the reporting, is what I'm saying, the weekly, twice a week, how much longer do you think this is gonna?
This is all pretty much died down right now.
I mean, like I said, we don't even hear about it on the news anymore, nothing.
Yeah.
Very little.
Something happened somewhere there where they locked a big city in
Yeah.
China now, as you know, and something spills over. I don't think we're going to have a problem, at least for now.
Yeah.
Again, it's difficult to predict. And
Like the next 30 days, it may just completely.
yeah,
Like,
hopefully,
like-
looking at the statistics in the hospital that Dia mentioned, there are hardly 3 or 4 cases there, and nobody's been ventilated.
I don't know,
It's a good thing.
yeah, if it's going like that, maybe we'll just leave it like it is for, till next meeting, look at it one more time, just leave it just like it is, that way we don't get everybody riled up. What do you guys think? Hey, don't think,
Well, that's what Brandy suggested is. so-
I mean, yeah.
I'm just saying, I
okay
mean, within
with-
another month, it's probably gonna be, we'll be talking about this again, saying either, down to once then, and maybe we should make that change then, that way everybody don't get riled up.
So you want to keep it twice a week now for 1 more month, and
I don't know, I
yes,
mean,
it stays.
She has the discretion to
thought
change
they
it
were-
at any time without the board's approval,
Yeah.
so she could make that call in 2 weeks. She might decide to drop it down to once a week.
That's
Yeah.
fine, Brandy, twice a
thought he
week
was
or once a
talking
week,
about
I mean, it's not a big deal.
you see the numbers, I mean, right there in front of your face, so.
Well, I think part of what I'll consider as well is obviously the contact tracing grant ends March 31st, but we do still have the COVID response dollars if we need to cover, staff to do that if there was another surge. But also kind of keeping an eye on when reports are going to stop by our neighboring counties, because that could be something to take into account. If we're the only one that stops, then everyone around us still does at least once a week, that could be negatively impactful. And so I can definitely take that into consideration. So the only thing I need to know is cumulative deaths. If you, as a consensus, want that completely removed or just leave it alone for now.
doing it?
I think it just depends on what the county is. Everybody's reports look a little bit
That's
different.
what I
The
was wondering, I
frequency
mean, I
looks
don't think
a
everybody's
little bit
doing that, I
different.
don't believe so.
That if you also, that part, I mean,
Okay, that's fine with me.
is that okay with everybody?
And then I just have one more thing in communication, Vivian. I think everybody's done. Any other questions with that? Okay, and then the only other thing, I didn't add this as an agenda item because I know you asked me just to bring it every month for right now. And I put a copy of it at your place, but is the Flex report. You'd asked for an update on that each month. So of where people were at as far as their beginning balance and then to be able to show what they would accrue through a time period. This does show at the top the accrual dates so that you can see how long that was. Can bring this to you each month. If this is not what you were hoping for, then I can ask you to make some edits to it. We thought this was something that hopefully will give you what you need, but we can also make edits to it if needed. I will say, as a reminder, we had talked about, we were doing that final flex payout with the grant ending March 31st. So these balances do for the most part reflect that being done, and remember I had mentioned we'll have kind of a fresh start to be able to start really keeping people down and be able to hopefully transition back to that old policy. And so that's what you can see here as far as where people are at. If you see someone that is, I know there's one person on here, I think that has about 30 hours. That person had something scheduled to use that time. So otherwise, I think we're doing better. We do have, as an example, in environmental health, right now they're doing a lot of temporary events and they're doing a lot of inspections on the weekend. So you may see some accrual with them as time goes on over the summer because of things they have to cover. They do their best to then allow them to, be off during the week, flex around those hours so that they don't, accrue flex or have it sitting on the books. And again, we don't always pay that out. And once that, temporary policy is gone, they won't be able to accrue over that 35 anyways. And it wouldn't be regular practice to pay out. So any questions? I'm happy to answer if I can, or
Can
bring
you
an answer back
explain,
next month.
because I'm looking at this and I'm confused, you got paycheck date, accrual date, explain what that means. Are these hours been accumulated over a 2-week period, or what are we looking at here?
So the accrual through date, that's the 2/18 to 3/4. So these numbers would, if you look at the flex beginning balance and then the flex end, our time clock has the 2-week pay periods. So that should reflect up through that 3/4. And then that paycheck that was on 3/11. So that also shows the flex that was paid out on the 3/11 paycheck. So this should kind of be after the payout and after anything they accrued through that pay period, where they ended up. The flex in balance would be where they ended up effective after that 3/11 date.
So,
The 3/11 pay date, so the 3/4 work day.
so just pick the first one at the top of the list, accountant. So are you telling me they accumulated 22 hours over the course of 2 weeks?
No, that's their beginning balance. So right above that column, you can see the flex beginning balance. That's where they would have already been sitting from all their historical accrual. So that's what basically is on their books. And then the accrued or used column, you'll see there that's like a -4. That reflects what they used during that pay period. And then the final column that says flex in balance, that would be what they had at the end of that 3/4 work day for all those 2 weeks. So the middle column shows what they would be accruing or using in that particular time period.
So are they getting paid for that time, or are they getting the time off?
No, normally they would get that time off. We did have some that got some time paid off as like that final flex payout that we talked about before that grant ended. And those were only the people that would have been over the 35. So you'll see, for example, if there are people that were in the first column who are an even 20, there's a good chance they were probably paid down to that 20, which is they probably were over 35. And so we paid them down to that 20. So you'll actually see a few people on here who were paid down to that 20. And hopefully that'll be the last flex payout, because hopefully nobody will be having to work a ton of hours anymore. But then the next column would show what they accrued during the time period at the top and where they are currently at as of the end of 3/4. So they may have even used more and be lower than what they are in that final column. I had Sheree run the report on that date just so it was ready and just a clean end of that pay period there. Does that answer your question, Mark, about
Yeah,
the
kind of.
first column?
So
Okay.
on the back page though, under WIC, it says CPA.
I was gonna ask that.
Is that, are we talking accounting people?
No,
Or does that
okay.
stand for something else?
No, that's competent professional authority. That is
Okay.
someone that works in WIC. So that is, as an example, that is one of the people that I was telling you did have more than 35, but she was going to be using the time and had a plan and scheduled days off. So that person is going to be using that time and did not have anything paid out. It will be getting used. I don't know her exact dates. I think it was this month or in April that she was going to use it.
And my last question, I don't see the administrator listed on here.
I should be on that.
Sorry, here,
Where
By under P, public health and
public health administrator,
Oh,
on the back side.
the rest of the administrators are listed under A.
Well, those are actually
Those
different
are
roles,
assistant,
so.
administrative
Yeah.
assistants.
Okay,
So just to be clear, the next time we meet, it's gonna be past the 31st. Unless there's some mitigating circumstances, like somebody quits and has to be paid down, that you, for the most part, you're going back to your normal, you are going back to your normal policies that you had before March of 2020.
Yeah, so we've been telling supervisors, really for months, really the whole time, they know this, the payouts were not a promise thing. It's never been, you know, a promise thing, other than when someone leaves, if they have some on the books like we talked about. But we've been telling supervisors, make sure you prepare, make sure you keep them flexed down, make sure you're having people take their time, get back into, you know, it's only for emergencies, obviously, or extenuating circumstances like having to cover for someone. If someone's getting close or at 30, make sure they schedule their days off. So I do feel like we're heading in that direction. I really hope nothing else happens with COVID. We are, not all positions are filled yet, but we're working on it, which of course then people take training or require training from other staff. So there's still gonna be those types of things, but that's only gonna end up being flex and time taken off. It's not going to be the payouts like we've done, which are not the regular practice. So yes, other than like you mentioned, if someone left, which right now I feel really good about where people are, because we have been able to, in, you know, situations where they had a lot of hours on the books, pay that down and kind of get that fresh start. And hopefully we're wrapping things up so that we don't have all the hours with COVID anymore and can sometime soon revert back to the.
So this is all because of the COVID, right? What would have been 2 years before this, 2 years ago?
You mean the flex time or the payouts?
The flex.
So the flex time was in place before, but
Yeah,
people
you know,
could not
but
accrue.
the extra hours that you show here, is this all because of the COVID?
No. This is everyone in the whole building. So I mean, it really varies. Why did they have to work over? Why did they earn flex time? An example is if we're short-staffed, which in most of the divisions we are to some extent. So you have people covering for others, or there's required trainings that might go through lunch, so they work through lunch and earn some flex time for that they can take off another time. So not all of this is directly related to COVID. COVID certainly exacerbated it for many people in the building, but other than being short-staffed, kind of, you know, on a regular basis, there's not as much of a need to earn that flex time or to have to work over and nowhere near what they did during COVID.
Is there really a need in all times to record it? I mean, what if somebody wanted to work an extra hour, they had something they wanted to get done? They're not gonna record that, are they?
They would. I think I'm pretty confident we probably have people that are working over and not claiming the time for themselves, or you know, don't want it for some reason, or trying not to you know, look like they're working over too much or getting too much flex or that kind of thing. I know that we have people who work and never get, you know, the time or anything like that. We do have to, when someone is actually working, we do have to clock it, like Mike Baggett talked about last month. One of the reasons that we do that is because for our grants, we do get audited, we have to deal with data. The documentation has to be very, very thorough, very specific. We have to show if somebody's working 30 hours in a specific grant versus 40, that makes a big difference for our reimbursement. It makes a big difference for how much funding we're going to get next year. It makes a big difference about how we are, you know, chosen when they're deciding how much money each county gets, like how much does Macon County get? Well, if it looks like we're working less in the grant than our staff really are, we might get funding, you know, taken away or decreased. So there's a lot of reasons why we need to do that. And then of course, when we get audits, you know, they need to have a very accurate reflection of how much time people are working in a grant as well, aside from just the reimbursement part. And so that is why we do stress to the employees. We do want them clocking everything. So we do have that accountability. Gosh, it was 2019, I think, when we had the audit that recommended that we get an even more detailed time clock than what we used to have, which was pretty detailed, that could show every quarter hour what grant and job code people were working in. So that was an audit finding for us to even improve upon the pretty detailed time clock we already had. And that is why we adopted this new time clock, EWS, that does tie to the county's accounting system, so that we do have the most accurate reflection of by the quarter hour what staff are doing and which job codes they're working in. And that is with the audit for the purpose of ensuring that if we're claiming that somebody worked 30 hours and we're asking for the money for that, where's our proof? And so that's why these things are so important.
Okay, any other questions for Brandy? Thank you, Brandy. Presentation and acceptance of financial report.
Okay, I am doing a financial report this month. She was not able to make it. So if you just want to review your documents that were in the packet, the first one, the summary income statement, you can see 25% of the year has passed. Our ending fund balance there is 6.7 million. And then the income statement detail, total revenue is at a little over 2 million, and that is 30% of our budgeted revenue. And then our total expenditures are at 1.7, which is at 25.5% of our budgeted expenditures, excuse me. That's it for that.
Any questions on the financial report?
Motion approved.
Second.
Thank you. A roll call vote?
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jeff Edwards.
Yes.
Dr. Brett Jerger,
Yes.
Dr. Venkat Maniganti.
Yeah.
Cody Parks.
Yes.
Dr. Janet Patterson.
Motion carried. Thank you. All right. Department expenditures are in your packet. Entertain a motion to approve those.
Motion to approve the financial expenditures.
Second, please.
Second.
Thank you. Any questions about those? Okay, roll call vote, please.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jeff Edwards,
Yes.
Dr. Brett Jerger,
Yes.
Dr. Venkat Maniganti.
Yes.
Cody Parks.
Yes.
Dr. Janet Patterson.
Yes. Motion carried. Thank you. Grant applications for review.
Okay, this one is in your packet. It's the one that says Macon County Health Department Grant Application Assessment Tool at the top. Pretty straightforward. This is some of those COVID response dollars that coming through the Illinois Department on Aging, specific for our Starting Point program. The purpose of the funding is to be able to retain staff, support staff, and so we are definitely going to apply for it. If you would please give us approval to do so. We have already started brainstorming what we could use it for. This is money that we talked about back at budget time that we were hoping to get to help support the new care coordinator, which is similar to a case manager in Starting Point. So this is something we talked about months ago, but they finally have put it out. It's due March 25th. And I think it could be really great for our Starting Point division if you would approve that.
March 25th is in short period of time. Is that giving enough time to, or is
We'll make it work.
they've already been working on it?
Yes. They only sent it out, was it last Thursday maybe? I can't remember what day, but you usually don't have a lot of turnaround time to write the grant. So you gotta just make it work. Hence something like flex time where we have staff, maybe up till midnight working on a grant just to get it in with everything else. But especially with this significant amount of money that can help improve things for our staff to be able to work efficiently and be able to support that staff person, we definitely would like to work to make it happen.
So that 75,000 for the remainder of this year, then 255,000 for next year, is that what it's like?
Yes, and their fiscal year is actually July 1 through June 30. So, which is different than the county one, but that FY22, the 75,000 would have to be spent or accounted for by the June 30th date. And we do already have a whole plan brainstormed out for both fiscal years.
What exactly does the money do? How does it translate into services to me?
So one of the things that would like to do with it is support that care coordinator staff. We were able to get approval from all of you and the county board to pay for that out of the health fund, waiting to know if we got this funding. In the Starting Point program, the care coordinators are basically like case managers, and there are rules for how many clients they can serve. And so our staff had been over, but there wasn't just available funding to hire more people to help with that caseload. And so when we were given permission to hire that new care coordinator, we did have actual adequate number of staff to be able to take care of the caseload based on the required numbers in our deliverables. Also, there are a lot of other things in this grant that you can do if you need to do upgrades to technology, for example, if there are staff retention things that you can do. So that might be professional development or training that staff might need. One of the things that they put in there was, bonuses, which we're not able to do, but some health departments or CCUs are doing that. If you need supplies, that's something that you can purchase with this money. So it's fairly open-ended, which is great, because if there are things that we need in that division, which there are, that this funding would be able to support that without having to ask you to pull from health fund dollars.
You have a high confidence level that you'll be accepted, or is it a?
Oh, yes, I'm sorry I didn't say that. We pretty much are guaranteed to get it. There's an allotted amount of money for each county. So it's one of those, like, apply for it so you can get it kind of thing. So yes, I feel very confident.
I'll make a motion to apply for the grant.
Second.
Well, is there a 25,000 missing there? The grant? Is that how we give it?
Okay, now let me go back to that. Okay, where are you talking about? And the grant amount?
You said the grant amount is 355, but break into financial years, they don't add up together.
That may just be a typo.
Okay.
It is the 355,
That's a good catch.
yes.
Nobody else got that.
So I appreciate that. Yeah, I didn't catch it when I looked at it either, but yeah, that's just a typo. It is the 355.
He's used to it.
I was calculating all the hours too.
I see the pennies, he's using 100,000.
Okay, so we have a motion and a second
Second.
on the floor, okay. So, anything else before we, roll call, okay, roll call?
Brittany Goodman,
Yes.
Mark Scranton,
Yes.
Jeff Engler,
Yes.
Dr. Brett Jerger,
Yes.
Dr. Venkat Nagante,
Yeah.
Cody Parks,
Yes.
Dr. Janet Patterson.
Yes. Good, motion carries, thank you. All right, so we have our department division reports in the packet. Does anyone have questions about those reports?
I've got one under environmental health. I'm just kind of curious to see the numbers are going up significantly, but I'm wondering how come we got 6 people in that department that can do inspections, and it looks like over 3/4 of them have been done by 2 people. The numbers are pretty lopsided. I know Whitney's been doing some other activities as well as doing inspections, but she doesn't have anything, but I don't know what the balance is there to try to get everybody up. It seems like you got 2 people that are running their tails off trying to get inspections done.
So Kathy is on and I'll let her speak to it, but I will say that some of it is, yes, Whitney is primarily our emergency preparedness coordinator. She was in environmental health before she moved years ago to taking on the emergency preparedness coordinator position. So it was always designed that Whitney would have less assigned inspections, and that was even before the COVID pandemic. Jerry, and I know I believe this is being adjusted with our newer people that are being trained, but Jerry has covered more zones than other staff, and that was intentionally set up that way. Colleen is one of our newer, you can see she's actually done several, but one of our newer people, that could be why her number's growing. And then John is the one that Kathy has talked about is our newest. So he is training, but I don't believe he may be on his own all the way now, but I'll let her speak more to that, but that was to give you a little bit of insight. Kathy, are you still on?
I am, and you are correct. The way that we have the work divvied up is that Jerry covers 2 full zones of food. That's his specialty. That's where he shines. That's where he does his education and training. So he does the food there. Colleen is starting to get trained on wells. So she has a area of food, or I'm sorry, a zone in food, and starting to get trained on wells. John is just now getting out on his own. So we're making sure that he's pretty comfortable with food, but then he's going to start getting into septics too. And remember that right now is also the time of year that septics and wells and all of those things start picking back up. to get those done. So those numbers have just been kind of low anyways the last couple months, but they're going to start picking up tremendously.
Thank you.
Okay.
I had a question. I had noticed that on the dental report, which I can't seem to put my fingers on, but I had a note that it seemed to be edging down a little bit, the number of x-rays, I think. Is that typical, or I think I saw 3 months in the report.
I can't speak specifically to the x-rays. I know that there have been some things that have happened that have affected their patient numbers here recently, both for the growing and for a little bit of a temporary decrease. So we have in the past month, I think it might have been a little bit before that, but completely adopted our new dental software. And so there were some days that the dental clinic had to be shut down in order to train all the staff and change out everything that needed to be taken care of. So that did affect the number of patients that we're seeing during that time. We also we received that grant that we talked about, so we were able to change the clerical there from part-time to full-time. And so they are looking at growing the number of patients that they see per day because they're able to start earlier and wrap a little bit later with her being added to full-time. And then also there have been some days that our dentist was not able to come in. And because we lost that contractual dentist to another health department, if the dentist isn't able to come in, then we are unable to see patients on that day, unfortunately. We have been very creative here lately at using our dental assistants in the clinic to help in other areas in the health department, but that may be where you're seeing some of the decrease with some of the days with whether or just if he has to be off for anything. We don't have a backup dentist. We have been in further communication with the contractual dentist that we used to use to see if we can start covering some additional days if our dentist does take off. But because he's full-time at the other health department, that's very difficult for him. It's hard to get dentists or contractual dentists help cover.
I got one more thing real quick. I know this just got done last week, but I'm curious to see if any response or what's the status with the cottage food registration. Has that started yet? Or is there any, people inquiring about that?
I'll speak to that, Brandy. So yes, the cottage food did get passed through county board last Thursday night. Friday, I worked on all of the forms from the state, transferring them over to our logo and our stuff. Evan worked on a new email address for me to be able to put on there. And then as of Monday, every cottage food operator that I had on file from the last 2 years did receive an email letting them know of the changes and the updates, included the new registration form and the act. And then I had 2 on my list that had just called in, just probably within the last month or 2, that I did call those 2 back, gave them all of the new information. So everything is current and just waiting to see who else is going to come in and start registering.
Did the county board approve the fee that we approved, or did they push that back?
They did. They didn't change it again.
Okay.
Okay. No more questions. Thank you, Steph, for the reports and all the work that you do. And we'll move to employee recognition. Our March anniversaries: Jamie Smith, 4 years, Mariah Kohler, 4 years, Sally Williams, 25 years, Ashley Bond, 5 years, Stephanie Mallory, 1 year, and Mary Irwin, 1 year. So we want to congratulate Steph on their anniversaries and thank them for the time and their services. Okay. Old business, OMA employer training update.
I just wanted to make sure that you all knew, I did send an email out, but just thought we should touch on it during the meeting. The trainings are available now. So if you have not taken that, you need to please do that as soon as possible. The Open Meetings Act requires it to be completed within 90 days of starting in your position, but it's been shut down, as you know. So if you could just complete that as soon as possible and get us proof of that, we would really appreciate it. And you can just email that to me.
Does it have to be done every year?
You don't have to.
I thought I did that before. That's what.
I don't think so. I'll double check on it though, and I'll definitely let you know.
Open meeting act, yeah.
I will
So you'll
double
let
check.
anybody know who doesn't.
Yeah, I will double check, and I can even, because if it does have to be done every year, then everybody will be due, so I'll double check. Since it's been open, I haven't taken mine just yet. We do it, our leadership staff and administration, we do it every year just because we want to keep staff updated, and if there's a change, and then we can bring that to you to make you aware, but I haven't done it, so I could definitely be wrong, so I'll double check on that, and I will let you know if you all have to do it.
All right.
And, oh, sorry, you are not required to take the FOIA training, just the Open Meetings Act, unless something's changed with that, in which case I'll let you know. But the FOIA is more just like a courtesy of letting you know that that training is there if you do want to check it out, since you're all subject to it. So I just want to keep that clarification.
Okay, so we've already done the COVID thing, so discussion and action for Board of Health appointments.
That's really just, we've been talking about that each month. I know last month you all said, leave it to the nominating committee to handle. So I just left it on the agenda in case the nominating committee needed or wanted to address anything, but if it may not be needed at all, I just want to make sure it was there if it was.
Nominating committee, you guys. Okay. All right.
Who is the nominating committee?
Cody's on there, I know.
Dr. Minigancy and Jan.
Okay, new business.
Vivian, just a minute. So last month we talked, Jan wasn't here. Is she interested in a term renewal or not? Because if not, we got a doctor's position to fill. That's kind of important to be really thinking ahead about that.
Are you talking about me?
Dr. Patterson?
Yes.
Yeah.
Didn't you guys say last month that her term was up?
It is, yes.
And we had nobody talked to her yet if she wanted to stay on or not?
I'm not sure.
I'm willing to, and I'm also willing to pass it off to someone else if you have someone that.
Oh, you can.
What's that? I'm sorry.
I said I'm willing to continue if
Okay.
that works for the board.
Yeah, because finding a doctor is definitely a challenge, I would say.
I'm just sporadic because I work in Springfield on
It
Tuesdays.
definitely requires more time, so.
I was not here last time.
So then we're gonna potentially 2 vacancies now, right?
In addition to Dr. Patterson.
Right.
And that's, of course, the county board chairman and county board would decide what to approve. But if our nominating committee and board has people that they would like to approve to move on, then the sooner we can get that to them, the better, because they will be probably putting that on the county board agenda in May, I would guess. Coming faster than we think.
Well, they actually supposed to vote on May, right?
Yeah, because the terms
So
would
we
end
really
May
need to have
31st and
names.
then
We need to have names next month, realistically.
And there are 2 positions?
There are 3 total,
3 total. Okay.
yes.
I thought there were just 2.
There's 3, Dr. Jerger, Dr. Patterson, and Vivian.
Okay.
That's fine. Which now, from what I have heard from each of those people, they're all interested in staying on, unless something's changed.
But that gets voted on by the county board. I'm sorry, I don't know too much about the process.
Yeah, they have the final approval. We're basically making a recommendation.
We just say and they think it's up to them.
Okay. So nominating committee, do they need to bring next month,
So
your recommendations?
I guess, so we actually, well, people, how do we find people that's, you know what I'm saying, how do you find people? As far as what I'm saying is, I mean, people don't come to us. If we have a spot that's open, that nobody's willing to take, how do you find I know that's sounds like a stupid question, but.
You never know. I've had 2 people approach me
That's what I'm
and
saying.
they got a medical background, but they're not physicians.
I'm just saying they're gonna approach people on the board, but if somebody doesn't, what, I mean, or, asking a certain profession, you know what I'm saying? I don't know if that's a bad question or a good question.
No, that's a very good question. So historically, we've had a lot of board members who have wanted to stay on and who have renewed terms, for years and years. If there have been vacancies, for example, the last time we had a vacancy for a doctor, I assisted and worked, with the nominating committee to reach out to doctors that were recommended. So that was either someone recommended by the board or someone recommended by staff or someone recommended, by some other stakeholder. And so, that's how we were lucky to get Dr. Patterson on the board by basically just reaching out to people who would have relevant experience and expertise to be able to bring to the board and ask them, are they interested? I made a whole packet that I could send people in advance that kind of tells them what the commitment is, what the expectation is, when the meetings are, so that they know what they're getting into before they would say yes to a possible nomination. And then those ideas would just be brought to the board, they would discuss, and then like Mark said, basically vote to make that recommendation to the county board chairman and therefore the county board. The county board chairman does have basically the right to appoint or not appoint. So as we talked about before, the county board chairman could say, yes to all 3. Like, let's say you presented all 3 of the people that we already have for, renewal of their terms. County board chairman could say no to all of them and just put completely different people on. But our board has always just practiced, looked for people, helped recruit, helped suggest people, and then recommend them on for that next step. So you could do,
When you say they put them on, if they don't pick the people we pick, and you say they put them on, is that what you mean? That they have their own people also, or?
the county board. So, what I've been told is that sometimes like county board people might choose
Okay.
someone, they might be approached,
So
They
they can
might
find people also.
owe them a favor or something, different things like that I'm not really involved in, but that's kind of what I've been told as far as where they get the people that they have. But yes, when I say they, I mean county board, because ultimately they can say, yes, we want the ones that the Board of Health has recommended, or they can say no.
Yeah.
We've had a situation in the past where our board was concerned there was a possible conflict of interest with someone that was running for office, but then the county board was okay with that, so they proceeded. So it kind of just depends, but really it is from this board, kind of just doing some legwork of finding people, especially if it's someone that has to be specific to meet a certain, professional expertise, and then recommending them on. I hope that helps.
If that's, yeah.
So, Vivian started to mention it, but the board attendance review, I would suggest Brandy's done that, task when I requested it. So I would think that would be valuable, not only to the nominating committee, but to the board to have a review of attendance over the last, term or whatever to make sure that we are meeting the requirements per the bylaws about attendance to the meetings, because I don't know where everybody's at. I think most of the people are here most of the time, but we never, at least since I've been here, we've never had a completely full board at a meeting. So, I know there's conflicts, with people that can't make a meeting for whatever reasons. So I think the attendance is important because that not only reflects the involvement of the board, but also when you're talking about considering somebody that may be up for term renewal, then that's something to take into consideration as well. I think it's important to attend the meetings. So I would think that would be something we would like to have for next month, or the nominating committee should get it.
Well, per the bylaws, the nominating committee is to review this in March. I did send it all to the nominating committee.
Okay.
March 7th, so they have hopefully had a chance to review it. And then I just put on the agenda for this month, so if they wanted to talk about it at all, but then per the bylaws, April is when they would actually review it with the full board. We do have, and this is probably what Mark's talking about, but just some little charts that reflect how many meetings people made it to, stuff like that. So the nominating committee does have that, and should be presenting it to the board next month for discussion.
Good.
Okay, So we will move on. Jeff, I think we'll interject you in right here.
Okay. I'll just kind of reiterate what I said earlier. I have a desire to learn more about the people that work here, about which gets into each department, and some specifics about the department. And I would recommend that on a monthly basis, one person per month, that we get a real short
Snapshot.
thank you, of what they're doing. Not only what their department does, but their specific job, and maybe some successes and challenges. And I think we want to limit it to 10 or 15 minutes. We were here a long time, and I don't know that we want to get too verbose. But
I came and did that once, just so you know. I came into environmental health. We were here for probably an hour, but we got into some pretty heavy stuff. But as a result of conversation, we're now going digital, for food inspections. So the good conversation came out of that. But I agree with you. I think we need to learn more and be better informed about what the staff needs from us as a board. And I think it's helpful just from a relationship standpoint, because I'll be honest with you, Brandy took me around when we first started on the board, and if somebody walked the door right now, other than maybe Kathy and a couple other people, I wouldn't know who they are. And I think that's not good for the board not to be familiar, at least with the directors.
And even for the people that have been on the board a while, it gives you a refresh, because I'm sure all of the people, their jobs have changed to a degree. There've been increases, decreases, but I would just make a proposal that we start that in the next couple of months. Open it up to any discussion if others think that's a good use of time.
I'll get back into the flex. You guys had issues with the flex time, so you get back into that. That's one thing. I know there's a wealth of information on the website. We get our department's division reports. I mean, I understand you guys wanting to, get to know people, which is a good thing. But if we're going to do it, we have to make sure we keep it very short.
I think 15 minutes, they can do a short presentation and have a Q&A. And I mean, just set a time limit for it.
When I first thought about it, I said 10 minutes, but to the benefit of the person that's going to present, 10 might be too short. I have somebody that feels strongly that they want the floor to be able to shine a little more. And
So are you talking about like highlighting one division each time?
yes.
Okay.
Yeah. I mean, they're sitting here on board at the meeting anyway, so it's not like changing anything other than we're asking them to be here in person.
Yeah, I would.
Well, they were here in person before COVID, so, right? I mean,
Yes,
we
the
were in
directors
the
are
other
always
room and
here.
they came, they didn't all speak, they were there available for questions, so.
So I guess that's the question, when are we gonna go back to that, and if that's the way it was done in the past?
I can answer both of those things. So Jeff did reach out to me earlier today. I think this is a great idea. I agree, keep it, within a reasonable amount of time, because, we do respect all your time very much. And I do feel like if we have a division, some of our divisions have a lot of programs and services that will probably not fit into 10 minutes. So we could maybe even have them split up and kind of just keep rotating. We used to do something kind of like this years and years ago. I think it was beneficial, and I do think our directors will be grateful to know that you want to know more about them and hear from them and hear about the programs and the struggles and the things that you can do to support and advocate for them. So I'm more than happy to, start this next month, or if you'd rather wait until May, give it a couple months, that's fine. But I think it's a great idea. I think we can ask the supervisors to plan for about 10 minutes. That way that allows for a little bit of overage and then also Q&A. And I think that they would be grateful for the opportunity to share information with you in this platform. If they go long, we can just rotate them out after everybody has a chance, so they can come back and talk more about, something they want to get more specific with. As far as to your question with bringing them all back in person, Some of them do stay in the building, but still join virtually. I have told them, you know, in coming months, we are going to transition back to that. As you see, our space is fairly limited. I don't want all of my supervisors in a room where they can't distance just in case, for at least a little bit longer. We've told staff for some of these big changes, give us 2 to 3 weeks, let us keep watching the numbers, make sure we don't go back into something. I can't have my whole, if something happened, there was an outbreak in this room, let's say over there, if they're all sitting there, then I have every director out of the building. And so I do want to be careful when we do that and try to still space them apart. So I am hoping in the next couple of months or so that I would be able to have them all back here again, because I think that's nice too for you all to be able to see faces associated with this hard work that's being done. And also the struggles that they're having, that you can, relate to them, and you can have more of that personable side. So I'm hoping within the next couple of months, but we can definitely start the presentations next month, and whomever is actually presenting, have them here, or like we've done, if they're in their office and we kind of just tag them in, we can do something like that.
Thank you.
All right. Okay, discussion and approval, intergovernmental mutual aid agreement for the establishment of the Illinois Mutual Aid System. Wow.
Right? Okay, so this is actually, thank you very much. This is actually in the emergency preparedness monthly report section. This is not a new thing, it just needed updated. All those updates were done by our emergency preparedness coordinator, but it is required by the grant that we update it and then just have the administrator and the board sign off, basically just give you formal adoption. And so Whitney is on if you happen to have any questions, but again, we just have to have kind of the check of that you are in approval with this before we can meet our grant requirement for it.
Questions?
How long has this been in existence, this particularly?
I don't know.
Department?
Oh, sorry, I didn't mean to cut you off. I'm not sure exactly how many years it's been in existence. Whitney might be able to answer that, but I know the last updates were in 2016. And it's not required to be updated every year, but it was time that we needed to get it updated.
So it's very, I read through it, and as soon as I saw it, this is just like Mavis. It's pretty much a mere fire health. It's pretty much the same thing, so. Definitely a necessity.
Yes, for sure.
Okay, if there are no questions for her, then I'll entertain a motion to approve.
Approved.
Second.
All right, and the roll call.
I'm doing roll call.
Oh,
We had to
okay.
step out, so, all right, Cody Parks,
Yes.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Dr. Patterson,
Yes.
Jeff Entler,
Yes.
Dr. Jerger,
Yes.
and Dr. Minagonsi.
Yeah.
Okay. Motion carried. Annual report.
All right, this is another thing, you saw this last month. This is the second to last page of your packet. And we have to put this out every year. So just wanting to just do a formal approval of that. And like I said, you had it last month, so I don't know that there were questions, but if you have questions now, I'm more than happy to answer them or have the director answer.
Questions?
How does this get disseminated? Is it, obviously it's a flyer, it's folded and sits here, but does it get emailed out or
It does, yes.
communicated in a lot of places?
Yes, we put it out to media, put it on our website, get it out through all the county departments via the board secretary. So any of the outlets that we would normally use for our press release distribution, it's pretty much identical for the annual report distribution. We also submit it to the state so that they have record of it as well.
Any other questions? All right, we have a motion to approve the annual report.
Motion to approve.
Second.
Thank you. And roll call vote.
Cody Parks,
Yes.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Dr. Patterson,
Yes.
Jeff Entler, Dr. Durger,
Yes.
Dr. Miniganti.
Yes.
Motion carried.
And then, oh, sorry, I didn't mean to cut you
Oh, go
off. For the, all we have to do in closed, unless anyone has anything else, is review the minutes from last month. So I can, I have those. If you all want to review them, and then if we need to discuss, we can go into closed, or if there doesn't have to be discussion, then they can be turned in there.
We can prevent going.
Yeah, I feel like that might, to go in for, a couple minutes, I thought that might save everybody, but I'm more than happy to do whatever. Sorry. My apologies. Just as a reminder, when you leave, you can leave these and then we'll shred them due to confidentiality.
Hey, Brandy, do we need to leave?
Nope, we're possibly not going into closed. Of course, take your time to review them. I know that it's a couple pages there.
Does anyone feel they need to have discussion?
I don't.
Okay,
No.
you good with just approving? All right. We'll entertain a motion to approve.
Motion to approve the.
Second.
Thank you. And a roll call vote?
Cody Parks,
Yes.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Dr. Patterson,
Yes.
Jeff Entler,
Yes.
Dr. Durger,
Yes.
Dr. Miniganti.
Yes.
All right, motion carries. Thank you. So if you guys will be sure to pass those minutes back this way, and I will, do you have anything else? Okay. Anything else? I have, oh, did someone say motion to adjourn?
No, I was just, that's
Oh.
all we needed.
I'll entertain a motion to adjourn.
So moved.
Second.
All right, in a roll call.
Cody Parks,
Yes.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Dr. Patterson,
Yes.
Jeff Entler,
Yes.
Dr. Durger,
Yes.
Dr. Miniganti.
Yes.
All right.
Motion carries.